A warm welcome to everybody who's joining us today. We're going to give it another couple of minutes for folks to join, and then we'll get started. Welcome, everybody. I think we're going to get started. We are recording this webinar, so for those who do join late and miss the beginning, they can see it post-event. I'd like to extend a very warm welcome to you. This is the third webinar in the WHO series on trust and pandemic preparedness. Very interesting session today on the digital information ecosystem and trust. I'm not going to take any time today. We have a wonderful lineup of speakers and a moderator too. My very valued colleague, Tina Purnat, is going to moderate this webinar. Tina leads the work at WHO on infodemic management. Although I must say, not just at WHO, but I think globally is the thought leader in this space. So very happy to share this with you, Tina, and I will hand over to you to moderate the webinar and introduce our speakers. So over to you.
Thank you, Sarah, very much, and it's really great to tackle today's topic, especially because I think, as we're going to see, we have four speakers of very different backgrounds, but actually all thinking about and working about the digital information ecosystem, and trust actually is at the crux of a lot of the work that anyone's doing in this space when it comes to how the digital information environment actually intersects then with our information environment and information diets and our society. So I'm very happy to first just introduce very briefly the four speakers that we have lined up. First, Alejandro Posada. He's the lead social scientist for the Rooted in Trust project at INTERNEWS. And this is a global pandemic information response program addressing the unprecedented scale and speed of the spread of rumors and misinformation through the information ecosystem. He supervises and provides technical support for risk communication and community engagement across 13 countries where this project is being implemented. And he's also leading global level research projects looking at the drivers and impacts of health-related misinformation. Then we also have Neil Johnson. He heads the Online Dynamic Networks Lab at George Washington University. And his lab builds maps, almost like Google Maps, of the online ecosystem across all scales, including its communities and roadways that carry misinformation and disinformation and other online harms. So he will show us examples of this. This map reveals new connections across topics and platforms, and also across languages. And I'll let Neil explain what insights we're actually getting from this type of integrated look. This map has been very useful for policymakers and platforms because it provides a tool for concrete policy discussions and interventions. Then we have Mariana Diaz Garcia. She currently works as a fellow at the United Nations Interregional Crime and Justice Research Institute. She is a member of the UNICRI Center to Combat Disinformation in Geneva, and her work has centered on developing and implementing projects focused on the role of technology in current security issues. So this has included anything from cybersecurity and malicious use of social networks by extremist groups and organized crime, as well as ideology and radicalization, and similar topics. And then we also have Alla Keselman. She's the acting chief of the Office of Engagement and Training at the National Library of Medicine at the U.S. National Institutes of Health. She leads a unit that links the National Library of Medicine and the NIH biomedical and health information to its users. And this emphasizes engaging populations and communities that are medically underserved, as well as professionals who serve them. She, in the past, coordinated also the NLM efforts in evaluating the impact of health information outreach and community engagement programs, and is also co-editor of a book titled "Combating Online Health Misinformation: A Professional's Guide to Helping the Public," together with two other colleagues, Catherine Arnold-Smith and Amanda Wilson. So this was a long introduction. I'm excited to have all of the four colleagues here. We will start actually first with short talks by all four, where we have asked all of you to answer the question from your perspective and work. What does a healthy information ecosystem looks like to you? So I would invite first Alejandro to share your screen and give us your perspective from your area of work.
Can you hear me?
Yes.
Let me okay, perfect. Thank you, Tina and Sarah, for the invitation. I'm super excited to be here, representing INTERNEWS and the Rooted in Trust project. So to get to the question, I'm just going to tell you very quickly about Rooted in Trust, and Tina already got us started. But as Tina mentioned, we're a global pandemic infodemic response program. We're financed by BHA. And for the past 2 years, we've been addressing the unprecedented spread of health-related rumors and misinformation. We've done this in 13 different countries across the global south and focusing on working with specific vulnerable communities that are immersed in some type of humanitarian crisis. And how we've done this? Well, basically, we partner with local grassroots organizations, and together with them, we do carry out community-driven rumor tracking and social listening. Through that rumor tracking and social listening, we promote two-way dialogue between humanitarian, media, health, and community actors. And we do this through the production of content and information that is localized, contextualized, factual, but most importantly, that it responds to the community's needs. Our overall objective is to promote a resilient and better prepared information ecosystem for at-risk communities. So based on this work that we have done and with Rooted in Trust, but also on previous health crises, on previous health crises and across many contexts, we've learned a thing or two about what a healthy information ecosystem might look like in this context. And some of the things that we've seen is that in a healthy information ecosystem, all people in the community have access to locally relevant, which that part is really important, and reliable information. They have the trainings and the education that encourages a critical evaluation of information, and I'll talk a little bit more about that. They have access to resources to verify the information whenever they have questions. And very importantly, they can inform decision makers about their needs and their concerns, questions, and ideas. And in relation to this, what we've seen is that in a healthy information ecosystem for vulnerable communities in humanitarian contexts, all decision makers are also welcoming feedback, questions, and ideas in a way that people do not fear consequences when being critical about how decisions are made. So a sentence or a metaphor that we sometimes use in our project is that for us, what we've learned is that a healthy information ecosystem is not one where you are not allowed to say that Elvis is alive, but rather it's one in when you say that, most people will shrug off their shoulders And those who have doubts about that question would actually have access to the channels and platforms where they can verify this information. So even though it might seem a little bit counterintuitive, for us, a healthy information ecosystem actually contains a healthy level of mistrust in information. And as such, a healthy information ecosystem is not necessarily one without rumors or without misinformation, but it's more one where people have sort of like a minimum level of education and access to resources so that they can verify information. And what we've learned is that this actually mitigates the impact of misinformation. So that's a bit from our end. Thank you.
That's really great points, Alejandro, because this is also what we found in our team. No one can actually get rid of all of the rumors, misinformation, or low quality information in the information environment. It's basically what our relationship to is and how we understand and react to it. So thank you very much for this. How about Neil? Let's go to Neil. Neil, maybe you can add on to this through your talk. I invite you to share screen. Perfect, we see it. Go ahead.
Great, thank you so much, Tina. And a lot of what I'm going to say is impacted by conversations I've had with Tina. Tina's been very important for keeping me kind of focused on the key issues of this. This is work funded by the Minerva project of the Air Force in the US, who have a keen interest in trust and influence, headed up by Laura Stegman. So I took this question as meaning, how do we make the actual ecosystem healthy? And so a first question is, well, what does the actual ecosystem look like? And I think if we all try and imagine what it must look like online, you might have some schematic cartoon, but we set out to actually find out what it looks like, to build the roadmap on which all of the however you define it, information about health, etc., moves. And what I'm showing you is that a tiny piece of it, and it looks a mess. And of course it looks a mess. You look at any roadmap of any city at a small, it looks a mess. And this is exactly what we see. But the most important thing about this is that it's local. And I'll explain what that means in a minute. What you're looking at is a piece of the map of 5 billion people. And these 5 billion people online could be any of us. Some of us may be part of this map. We organize ourselves into communities that we trust online. So a Facebook group, Facebook page, but also on other platforms where we trust each other about parenting or pets or pizza. But we also may trust or distrust, but certainly trust when another member of the community tells us something about some other field like health or vaccines or elections or monkeypox or abortion. And so what we did was map out precisely this conversation. So what you're seeing here, each circle is an online community on Facebook. And the connections between them are where they link to each other. So if a community links to another community, it can be sending its members, sending its content, sending its influence to that other community. And it's also receiving content back from that other community. So we map this out. What you're looking at is the piece of this, a small, tiny piece of the online network, the online ecosystem that was discussing vaccines prior to COVID. And one thing that you can see is it's a global mix. There's a mix of geographies. So there are state level communities linked to local parenting groups, linked to country groups, linked to global movements against vaccines, linked to, again, back to some small town in Ohio, etc., talking about their water quality. And they're all interlinked. And so I think a key takeaway of this, and this is before I even show you what they're talking about now, is that distrust, whatever it is, it gets reinforced locally. So I think this might help explain why mitigations that are often funded at the level of do topic X in geographic location or at scale Y are facing problems, because immediately there's reinforcement at this local level where countries are next to communities thinking at the level of country are next to ones thinking at the level of the local town, next to ones thinking about, you know, GM foods in some continent you've never been to. So this was before COVID. And the remarkable thing is that since COVID, they haven't gone away. In fact, their conversations expanded. It's not just vaccines, it's also now climate, monkeypox, abortion, election, because once that distrust is there, it's there for other topics. And so this is my second slide. So just we can dig in. Now I'm digging into this like a Google Maps. I'm zooming in and I'm looking at, you know, I've kind of put in, now I want to see, you know, which circles, which communities. So each circle is a community of up to 1 million people. And what are they talking about? What is the conversation? And when we go in and we color code, looking at what each of these communities are, we see that it's an incredible mix of, although they're all involved or were involved in the vaccine debate, they're now talking about, well, what is an abortion? What's going on in the local elections? What's going on in elections in a country in Africa? How does this deal with involve climate change? Do we distrust all of these topics? And so the bottom line takeaway from this is that we can now use this local map to guide mitigation. So if there's mitigation in some country or some state or at some level, we can see, well, where is that distrust being reinforced? Because a program at the global level may need to interact with some small town in Canada, which is actually driving a lot of the global community's distrust. And we can also see, as changes in this map happen, we can then see how those might be related to mitigation schemes that are focused on that particular area. Okay, thank you.
Thank you, Neil. I'm curious what's on the rest of the slides. You just pulled me in. So.
Yeah, well, then the next slide, I take it into, well, that's just one piece of that's one piece of the puzzle, because that's mostly mainstream people. I think many of those people are not what you call extremists, but they're one step away often from communities that will be labeled extreme. So it moves into hate, it moves into extremist discussions, kind of anti-government, and then you're into what was considered the fringe, but it's not the fringe, it's next door. So that's what's on the other side.
This is what we've learned exactly during COVID-19 when we started looking at your map specifically, and you were talking about this as well, how actually the communities that we need to focus on, for example, related to COVID-19 vaccines are things like communities related parenting groups and baby groups and things like this, which actually are connected so much in conversations online. And you showed us evidence of this as well. Thank you so much. So actually, this is a bit of a segue to Mariana's talk from perspective of disinformation and hate speech, I hope. So Mariana, please go ahead.
Yes, thank you, Tina. Let me share my screen. Okay, can you see it? Okay, I want to talk about the work that UNICRI has done, so you understand the following slide as well. UNICRI has focused since 2020 on studying disinformation, specifically from non-state actors. So in 2020, we did this report that centered on the flow of disinformation during the pandemic. And then recently this year, we published this handbook on CBRN disinformation specifically. So we are analyzing the strategies of actors during CBRN events, for example. And we try to study the techniques, the strategies, but also what you can do to minimize the flow of disinformation or how to address disinformation. So under this perspective, I'm going to show you what a healthy information ecosystem looks like. Well, first of all, I think there are a few elements that we need to consider here. For example, every time we have an event like we had the pandemic, it's very important to understand the needs of the population when we are addressing any topic. Because we need to understand what the population is expecting, or what it might be relevant for this specific event, or what it might come in I don't know, in a few days. So we need to also try to understand what type of information people are interested in. And this is something we saw a lot during the pandemic, where we have this flow of information, infodemic, and it was very complicated because there were multiple topics that were being discussed at the same time. But also something that is really important is to have a good infrastructure. So to have the well-established communication channels. And as we have seen in the last few years, this perhaps means having a well-established social media network, and just having the correct strategies, which leads to the following point, which is the creation and dissemination of information. So it's really important to have established or pre-established some strategies to plan and execute specific communication strategies when addressing events in this case, because what we have seen during our research, of course, is that there is a lot of different type of topics being discussed, and sometimes it's very complicated to address them all at the same time. But what we have seen as well is that these, for example, violent non-state actors like the far right or other extremist groups are quite efficient in their communication strategies. Also because they don't necessarily need to tell facts, of course. So it's something that it's highly relevant. And another point to consider, of course, is the outreach and access to ensure that the public or your target audience has the correct and relevant information, and that you can reach them correctly. So it's very important to analyze this when you're trying to confront this information. And of course, the reception and the impact of the information that you're sharing, because this is a very important point, specifically also when you are, and I'm going to talk about this later on, trying to debunk disinformation or misinformation. You need to make sure that what you're doing, it's clear, that it's simple, and that it's tailor-made for a target audience, even after this specific event. So it's very important to consider these points. And the last point I want to talk about is trust and media literacy, because we are aiming in our work, for example, to really try to create this trust connection, because we mainly also focus on trying to make organizations or governments have a good media communication strategy when you have an event like the pandemic was, for example, to build this pre-relation of trust, which we think it's quite important, because people will respond to this in the future. But also to give, and this is something I think it was mentioned before, to give people media literacy tools to react to future events, or to just have a different interaction with the information they are seeing in a daily basis. So it's also we think we need to focus a bit also on the preventing part and not such in the reactive part. So also trying to give people these critical analysis tools and just media literacy in general. I think this would overall conclude in a healthier, at least, information ecosystem. Thank you.
Thank you so much. This is a good overview of basically a strategic approach from any organization that needs to be responding and thinking about response. So thank you for this perspective as well. I'd like to move on to Alla. Alla, I invite you to also share the screen, or actually no, Sarah, please, would you do that? And speak about the libraries as trusted spaces, please.
Thank you very much, Tina. Good morning or good evening, depending on where you are. I am honored and delighted to be here. And having the benefit to be the last speaker, I clearly see themes in the excellent talks we've heard, and I will continue those. So I'm going to start by breaking the rules a little bit and changing the question from what does a healthy ecosystem look like to what does a well-prepared user of a realistic ecosystem look like. I cannot define a healthy information ecosystem because to me, in a technologically connected world, information ecosystem will always be characterized by breadth, diversity of content and quality, complexity, and very rapid speed of information spread. So it has and will continue to have everything, the good, the bad, and the ugly. And even the good is not all similarly good. For example, accurate authoritative information may be complete or incomplete. It can also be relevant or not so relevant, and it can be written in clear, plain language or in convoluted, confusing sentences. Now let's take so-called bad information, which is even more diverse than good information. Bad information is not a scientific term. Another term that we commonly encounter in the media and scientific literature is misinformation. But professionals who tried to define misinformation quickly came to see that it is not easy, as misinformation comes in many different forms. For example, there are misinformation beliefs that are sincerely held by their producers who create and propagate their honest misconceptions or fallacies. Then there is also intentional disinformation. Its intent is often malicious, such as to sway public opinion, cause harm, or promote particular agenda. But at the same time, spread of misinformation can also start as a prank or a joke. The main point I want to make is that while it's easy to contribute to the information ecosystem, and while contributing quality information and creating pathways to it increases health of the ecosystem, curating or controlling it is a losing battle. So I suggest that large attention should be given to users and what makes them susceptible to misinformation, or resilient and prepared to deal with it. Could you please ask for the second slide? Thank you, Sarah. From research, we know what characteristics influence people's ability to withstand health misinformation. Of these, I would like to emphasize 3 that can be changed through engagement and education. This does not mean they can be changed easily. I want to mention 3 factors in particular. The first resilience factor is information literacy, or according to an influential definition by Pinto and colleagues, a set of aptitudes to locate, handle, evaluate, and use information efficiently for a wide variety of purposes. Information literacy involves knowing how to evaluate an information source. It is also knowing to check who is behind a website, what credentials they have, and what their financial interests are. Information literate individuals will also check publication data of a source and look at the quality of references. The second resilience factor I'd like to discuss is science literacy, which involves understanding a bit about how science generates knowledge and how it attempts to control for bias and self-correct. It also involves viewing science as a preferred way of answering certain types of questions. This is science literacy in a nutshell, although there is more to it than I can do justice in 5 minutes. The third resilience factor I'd like to mention today is trust in entities that fund, produce, and deliver information. These entities are governments, the public health establishment, the healthcare system, and the press. When people approach information seeking with high levels of these competencies, they are a lot more likely to take from the ecosystem what is healthy rather than what isn't. In the last round of my presentation, I promised to talk about what libraries have to do with this. But in brief, if improving information ecosystem is about building trust and helping people recognize good information, we can start to recognize that libraries and other communities organizations are partners that have a lot to offer. Thank you.
Thank you so much for these points. We've actually also seen in the analysis of the outcomes from COVID-19 response that one modeling study that was published last year actually put as the only predictor. It wasn't so how well a country's population fared in COVID-19 health outcomes. So how ill they were and what the mortality rates were. Wasn't connected to the GDP, it wasn't connected to how well prepared they were, but it was actually linked to trust in governments and trust in each other. So interpersonal trust as well. So and thank you so much for your perspective. So yes, you did allude that we prepared some more questions for you. And we would like to dig deep just a little bit more before we turn over to the questions from the audience. So I'd like to ask all of you really briefly to respond to reflect on. So then, what kind of information do the audiences or communities that you study or you work with, what kind of information do they consider trustworthy, and how do they determine what is trustworthy information to them? Maybe we start with Alejandro first from the humanitarian perspective.
Sure. Thank you, Tina. So there's a few points from our work related to this question. I think to start, it's important to mention that what we've seen is that the real complexity that we've encountered across the countries where we do rumor tracking and information ecosystem assessments is that more and more communities are faced with a combination of an information overload, but very importantly, like a lack of information that speaks to their specific contextual needs. And what we've seen is that people want to feel comfortable and they want to have channels to ask questions without judgment. So I think it is on information ecosystem actors to pay attention to where people are talking and how they are talking, like all the work that the WHO and INTERNEWS and other organizations have done on paying attention to rumors. It should not just be about fact checking, but it should be about creating systems and approaches that listen to people where they feel comfortable and talking in a way that they feel comfortable. What we've seen is that trust is influenced by a variety of factors, including like historical events, ongoing circumstances, but also embedded power dynamics. So at INTERNEWS, we developed a trust framework that considers 4 core elements that helps us understand the whys that drive influence and trust in information. There's the 4 core elements. The first one's proximity, which alludes to a lot of what Neil was mentioning. It's not just physical proximity, but also mental proximity. Do I feel represented in the sources that are speaking to me? Accuracy, which is not just about being factual, but also about context and timeliness. When is the information coming and is it contextual to my needs? Intention, which is the transparency and the special interests that are held behind the information and how I perceive them. And finally, control and the importance of freedom of choice and privacy in the information that's coming to me. So each of these elements has 3 sub-elements that helps us understand how people perceive the information in their environment. And this trust framework, we developed it because we know that trust is a dynamic relationship, and the intention is to allow organizations to understand which aspects they need to work on as they improve the relationship with the communities that they serve. So we're hoping that it's a framework that can be used by many organizations.
Thank you. I think it would be interesting to see how this is put in practice, as I probably don't need to tell you, Alejandro, that trust is easily lost and very hard to rebuild. So actually having some kind of a framework to work with is really helpful and more transparent to show how complex this is. Neil, how about your reflection on this? We can't hear you. Can you hear us? Okay, you're sharing screen. We can see it perfectly. But we can't hear you, Neil.
Great. Yeah, no, I didn't say anything. You're quite right. So
okay, good.
I didn't say anything. Yeah. Now I will. Yeah. So I'd like to just so the difficult thing. Let's consider one of the stories that still echoes around and is one of the reasons why there's a distrust in science more generally. I mean, if you ask many people, you know, what's the, particularly in Latin America, it was, you know, Colombia, where I go quite a bit. You know, this was a big story that there was some kind of a chip, of course, in vaccines. And so we've all heard these things, you know, Gates Foundation, it's to do with Gates, it's to do with China, it's to do with injecting sensors into kids, etc. So, you know, obviously this looks absolutely ridiculous. And, you know, the BBC website, they're showing, of course, how could you get a chip inside a syringe? It's ridiculous. But of course it isn't. Because, I mean, it's not happening. There is no chips in vaccines. However, what they did is they picked up a piece of real science that happened by bad luck to come out in December 2019 in Science Translational Medicine, which was funded by the Gates Foundation and was funded. This is the kind of difficulty of kind of addressing head-on information. It was funded by the Gates Foundation and the National Science Foundation of China. And it was a very clever piece of science whereby in rats, they managed to put quantum dots, which are tiny little, can act as tiny optical semiconductor chips, into a liquid as a vaccine, as a proxy of a vaccine, and injected it into the rats, and they could detect these quantum dots. Lovely piece of science, amazing. And, you know, Scientific American ran this headline in the upper right, which is the invisible ink could tell whether kids had been vaccinated. And they had a quote from the team that, or the team eventually wants to inject sensors into vaccines. So this was picked up. So this isn't wrong science. The science is correct. But of course, the will is not there. I mean, just because a car exists doesn't mean that we're going to just mow down everybody in the street. So this is the tricky part. And I think sometimes the media, and in this case, the BBC, who were pushing out this picture to kind of ridiculize the story of a circuit fitting into a syringe, because that's how I take it, you know, they were wrong to do that because it just inflamed the groups who knew about this paper, whereas the BBC did not seem to. Thank you.
Thank you, Neil, for an excellent example of this. Mariana, how about you? What is your response to this?
Yeah, well, as I previously said, we mainly also worked to train, for example, government communicators or strategic communication officers and CBR experts to address this issue. How would people trust you, especially when you're competing with misinformation or disinformation outlets? So what we always tell them, and I know Tina already knows this, that I always said is we like to put forward this idea of having a very simple and a short response sometimes to this information, because in that way you have a lot of clarity and you avoid the further confusion. So we always propose debunking strategies such as the truth sandwich, for example, where you state facts first of all, then you warn the population that what you're about to say is false, then you repeat the false claim, and then you end up with a fact. And then in this strategy, you try to not leave any gaps. So we think that a good way to enhance this trust in the population is be very clear and share the information in a very simple way, but also to allow people and to allow this target audience to corroborate the information. So we can discuss sources, we can put forward some other ideas, but it's very important for us to give this space for population to also corroborate the information. So in this case, we think that that's a way where people can build a trust relationship, especially when we're talking about international organizations or governments or any other actor that has to respond sometimes to disinformation or misinformation. And as Neil just explained, like sometimes you have this huge confusion just because there is a lot of information, and sometimes the strategy to communicate is not the clearest. So there are many groups, as we have studied, that take advantage of this. So we try to put forward this idea of just keeping the information short and simple, try not to leave any gaps, and just allow people to corroborate the information as well. Thank you.
Thank you for this. So this leads me back to Alla. What would then the users or the clients of libraries, what do they consider trustworthy information? What kind of information?
I have to start by saying that I'm a cognitive psychologist, so it will be colored by that perspective. But people find most trustworthy what fits well into their pre-existing beliefs and norms. New information is not processed in a vacuum. Instead, it's a Lego piece, a Lego block, or a puzzle piece that, in order to be accepted rather than discarded, needs to fit into the overall structure of connected pieces that are already there. And sometimes a necessary bit of prior knowledge is missing or inaccurate. For example, if I don't know how molecules form bonds, I will not understand the explanation that carbon monoxide is dangerous because it binds to hemoglobin instead of oxygen. And I will also have trouble if I think that a hemoglobin molecule can take on as many connecting molecules as possible. What's more, health beliefs are often part of individual and group identities, and so people try to choose information that conforms to their pre-existing beliefs and identity. If almost everyone in my social group believes that childhood vaccines are dangerous and that they need to protect children from them, this belief may become quite central to my social world and become the glue of my social world. I may bond with other parents and form friendships around conversations about how to find a pediatrician who will agree to treat my children as patients without them being vaccinated, or about how to obtain a vaccine exemption from school. Opinion change and corresponding behavior change then will be costly because it may lead to straining and losing my relationships. This is frightening, and unconsciously I will work hard to find faults with the information that challenges my beliefs. Fortunately, congruence with pre-existing knowledge and beliefs is not the only factor that people consider in evaluating information. We know from research that in judging trustworthiness, people respect both familiarity and expertise. They trust familiar sources and are convinced by examples of others in their close circle and community. This means individual change is not easy, but once it starts, people influence one another, creating dominoes effect and attitudes. But also with some caveats, individuals also often recognize and respect expertise. In many countries, according to surveys, people typically express high degree of trust in their primary healthcare providers, scientists, and public health agencies. And I know we talk a lot about science losing public trust, but it really, really depends on how the questions are asked, how science is defined, and what particular scientific topic is being discussed. And people also trust information that is produced or delivered with the involvement of organizations with which they have relationships and which they perceive as caring or unbiased. Thank you.
Thank you, Alla. I think actually all of the perspectives that our speakers are are presenting actually are pieces of the puzzle that paint a much more vivid picture of what we're discussing. So before we go to questions, so Sarah, maybe you could prepare some very lightning round, very fast round. I would like to ask all of you then, what can we do to promote a health information ecosystem, basically to promote that health information, credible, accurate health information successfully competes or is more trustworthy than mis or disinformation. Let's continue again from the top. Alejandro first.
Thank you, Tina. Well, from Roots in Trust and INTERNEWS, what we've learned and what we believe is that a key driver to promoting a health information ecosystem it's really about building and maintaining the relationships and networks across various ecosystem actors to ensure that there's real dialogue and actual exchange of information, and very importantly, a willingness to listen to each other and to communities. And this takes a lot of time, and it's sometimes it's too late to do it when the crisis is already there, but it's actually part of our preparedness approach. And our objective really is to ensure that when a health crisis does come about, communities actually have access to reliable and science-based information, which a lot of the times comes from health agencies and scientific backgrounds. But very importantly, that this is combined with contextual knowledge, which comes from civil society organizations and community engagement, and that it is discussed via two-way communication channels through the platforms that people have access to and the ones that they're actually like using. What we've learned is that when those three components work well together, communities and people, they feel acknowledged, and locally relevant and reliable information can actually become a valid alternative to mis and disinformation. All in all, to respond to the question, what we think is that collaboration is necessary to avoid that actors are just focusing on their own strengths, but they're failing to work together. Because I think part of what we learned during COVID-19 is that whenever there's ill-timed and ill-informed communication, this actually further alienates affected populations, and it just leads to growing frustration and distrust, which, as you mentioned, Tina, once there's distrust, it's very hard to rebuild that trust. Yeah, so it's a lot about those networks and relationships that are built across actors, between the media and the health sector, also between the media and communities and civil society organizations, with science, so that's how we view it.
Thank you, Alejandro. If I move over to Neil, you've done some really great work thinking about this and how people actually interact in different online communities to information and with each other. What's your take on this?
Yeah, thank you, Tina. And these are fantastic points. It's a privilege being on this panel. For me, one thing I'm really concerned about is like what's going to happen in 10 years. For example, as Twitter, whatever happens in the evolution of the ecosystem, something like Twitter, there's Mastodon now, Meta just coming up with their own decentralized platform. Decentralized means there's no central server. It doesn't belong to any particular country. And so the platforms will evolve just as much as the misinformation will evolve and the communities will evolve. The platforms will evolve. People move to other platforms when they feel chased off of a platform. So for me, creating a healthy ecosystem in the future, like I said, involves what is that ecosystem. So in the background, I've got just an example of how complicated it is. I showed you in the slides what's going on within Facebook. So in the background, Facebook is purple and Twitter is green. But the colored lines are actually extremist and hate communities. So these are ones actually with hate speech in them that we've classified. And the white dots are the parents and the local health authority, everything that isn't hate speech. And just look how messy and interconnected this is. So I'm very worried about the focus of discussions on, say, Twitter, which is green, or just on purple, which is Facebook. There's all sorts of platforms in the background, and there's all sorts of connections between communities across these platforms, even though, we don't, if we don't use the platform, we don't know about it, but they know about it. And one of the things I'm particularly worried about, as I said, next 10 years, the youth, kind of youth population using gaming platforms, gaming Discord channels, etc. That is such a key element of this ecosystem in the background. They spend many hours online playing games. There's a lot of downtime where they have nothing to chat about. They begin to chat about things, whether they've taken they've had their vaccine for whatever. They talk about all of these sorts of things. We have to understand that part of the ecosystem as well.
Exactly, and actually, the decentralized platforms are going to be even not going to be just limited to Discord and for gaming, but like you said, they will become mainstream, and that people that are currently growing up with the platforms now are going to also have a very different relationships and interaction to it. So thank you for this point. Mariana, how about you? What would be your response to this?
Yeah, well, first of all, I would say that it's very important to keep doing research on how, for example, this information is created and for which purposes, because what we have seen in the last few years, and with this information in particular, is that there is entire strategies behind this information, particularly when we're talking about extremism, when we're talking about specific political purposes, or when we're talking about different topics. So it's important to keep doing this research and to keep trying to get this information to the public, because it's important to understand how the different angles of this issue. I think that's important to just keep people just aware of what the situation is, because it, as Neil just described, it's quite complex. So it's important to try to keep that. And also, as I previously mentioned, it's very important, at least from our perspective, to build this media literacy in the population, and to perhaps focus also on pre-bunking, which is just trying to anticipate perhaps questions or perhaps issues that you might face in the case of an event, and try to answer them before the misinformation or disinformation happens, which can be sometimes difficult, but sometimes can be simple in case of I don't know, specific events, as we saw in COVID, like the topics related to vaccines and to all these things. Some of the issues could be anticipated in terms of what the population might ask. But definitely focus a lot on media literacy, and to keep this training, basically, not just for this, but for any event in the future. Of course, it's very important for the population to have this knowledge, and because it's important to focus more on the prevention aspect as well, rather just in the reactive responses, because once the problem is out there, it's very complicated to respond to everything at the same time. So we think that's what's one of the things that can be done, of course. And also, as I also mentioned, it's building a trustworthy like communication channels between any organization or any people that has to communicate anything, and the population and the target audience. And this will help that in the case of an event, it's easier to transmit this information and to make and just to have already this trust relationship between an organization, an actor, and the rest of the population, and to be aware of what people need. And I know that WHO, for example, did this social listening exercise where they tried to identify the topics that people were discussing. So it's always important to understand what people need in the moment, and then just answering to that. And I think this eventually will just create overall a healthier information ecosystem, where you have people that already know how to read or how to analyze information in general, and how to evaluate sources, and that it's an exercise that keeps building, of course, throughout the years. Thank you.
Thank you very much. Let's go over to Alla also briefly to respond, and Sarah, apologies. So I think we're running a little bit close to the time, but I hope that we will find some time for some questions. Alla, over to you.
Thank you, Tina. So as other speakers pointed out, the most important ingredient of delivering information that is seen as trustworthy is building relationships with communities of information recipients. And when it comes to building relationships, there are just no shortcuts. This takes time, this takes commitment, that takes concerted efforts. And relationship building is also the process that needs to be happening continuously, not just at the time of a public health crisis. We need to have those channels ready. We know that building relationships with communities is most effective when partnering through trusted community organizations. And I promised to talk about libraries. This is where libraries come in. And here I'd like to say a few words about my organization and about our engagement with libraries. So I work at the US National Library of Medicine, which is one of the institutes of the National Institutes of Health. We're the world's largest biomedical library, and we're also a health informatics research organization. And we build many health information tools for different audiences, including the public, and are committed to delivering our information to these audiences. So for delivering our information to the general public, we have the network of the National Library of Medicine. And the network consists of 7 regional offices around the country, each working with member organizations in its regions. At the present time, the network has over 9,000 member organizations. Many of them are public libraries. Partnering with libraries has many advantages because they are already known and respected in their communities, and they're already involved in community engagements through efforts like outreach programs, community advisory panels. And for example, in the United States, public libraries also typically provide broadband internet and computer access to those who need them. So the network serves its members by offering free trainings and workshops, funding health outreach projects, health information outreach projects, delivering health information materials, and organizing traveling exhibitions. As an example, during the height of the COVID-19 pandemic, many network regions funded awards that involved partnering between public libraries and health organizations, and those partnerships focused on promoting local information resources from reliable organizations, in some cases delivering books to hard-to-reach and remote communities when everything was closed, teaching information navigation skills, and more. Of course, we're not the only organization involved in information delivery in communities, and the importance of community engagement is a known factor in public health communication. It's just an example of an implementation model that stresses that credibility of health information is to a very large extent about the relationship between the deliverer and the community and the bidirectional dialogue. Thank you.
Thank you, Alla. Very well said on the essence of what quality engagement and really understanding of each other really means when we were talking about relationship between source of information and the community. Sarah, over to you. Now I'll be the bad person. You please. I hand it over for questions, and let's see. I leave it up to you when to stop.
Sure. Thanks, Tina. So actually, I'd like to say thank you to Alejandro because you've been rapidly answering the questions in the Q&A anyway, so you've done part of the job for us. That's absolutely wonderful. I think there was one question that maybe actually Tina might value your perspective on, and that was a question, how can you eliminate or reduce the drivers of misinformation? And then we can maybe hand to the panelists.
Yeah, that's so from point of view of health domain, when you're thinking about, so in the health domain, we've defined infodemic as this surge of information of very different quality that overwhelms communities, especially during an emergency. But the underlying information and the questions and concerns are there also before the emergency. So the harm from unanswered questions or unaddressed concerns in the community, and this is not only about information needs, but also needs and questions about services, health services, other services that the community is expressing that they need when they go unaddressed, and also when the information that communities are seeking goes unaddressed. That actually leaves a lot of room for mis and disinformation to form and to take hold, and that can lead to, when this is repeated and aggregates, that then leads to harms that can be expressed both in form of, at the individual level, in anxiety, on health behaviors that are not behaviors that are not supportive of health, like taking of unproven treatments or medications. At community level, it can result in polarization or conflict. At societal level, it can look also like different polarizations. And at health system level, this could be take forms of cost to people going to seek health services too late, delayed health seeking, or being ill from taking unproven medications, etc. Now, how can we address this? I would say, and I would subscribe to this idea, the one of the themes that has come up from the webinar. We need to do much better understanding what communities and people need, what questions they have, what needs they have. And it's our responsibility to address not only the information needs, that's a fundament, but also how the services are delivered and how their needs are addressed. Otherwise, I have a good friend of mine who keeps repeating that mistrust evolves out of a feeling that that promises were broken and values were violated by whoever is serving the community. And we must be much better at meeting the needs of the communities and taking responsibility for our part in this. This is more the philosophical answer, but it comes down to what I call the next evolution of public health, Sarah. It's really the center, I think, of public health and actually relationship with communities. Over to you.
Thanks very much, Tina. I think we're actually at time and beginning to lose people. So what I'd rather do is just ask our panelists if they had any further final thoughts to share with speakers, and then we'll close the webinar. Does anybody want to give a final comment? Feel free to jump in. Neil, go for it. I saw your hand.
Yeah, I just like to thank you. I actually think, and this is completely unbiased, I think the World Health Organization, by doing this and bringing us all together from these different areas, I think and Tina, thank you so much for that. You are doing the steps that are necessary. You're thinking across the topics, you're thinking across the scales. This is it. This is the, and I think that's absolutely, I'm not from the public health sector per se, but I absolutely think you hit it on the nail on the head, Tina, of what public health going forward has got to be. And you mapped it out perfectly. So thank you.
Thanks very much, Neil. Any other panelists before we close?
I just want to say that thank you very much for organizing this. Thank you very much to all the attendees, and for the panelists. I hope this conversation between us continues, and this is just the beginning. Thank you.
Mm-hmm. Wonderful, thanks, Alla. So great. I'd just like to say thank you to everybody who's joined us today. I think there are a number of different channels that we could have dive deeper down into, and that just means that we need to follow up and continue with the series, continue with the conversation. So thanks to all who participated today. Thank you for the questions, and thank you to Tina.
Thanks, sir.
Have a wonderful rest of the day wherever you are in the world. Bye.